I'm Deb Barnes and I look after my mum Thelma Barnes. And in 2017 my mum got breast cancer and her home is in Eaglescliffe, so I work in Hartlepool. So we thought it would be best if she actually came to live with me rather than me live with her. She was in and out of hospital from about 2018 up to about 2020, 2021. We got through COVID really well actually. And then after COVID, she started to develop these infections again. And we're at Havelock Grange in Hartlepool, and there's a practice nurse there called Katherine who came out. She's a lovely lady. And she was like, you know, your mum's, we're going to have to get something sorted again, and we think she should go into hospital, to which mum was really upset. And it was her that said, there's actually there's a service called the Frailty Virtual Ward, and that's how we discovered the Frailty Virtual Ward. And really since then, you're more at ease because you know that there's someone going to be there if we need someone. We don't have to do this journey to hospital, because even the journey to hospital for someone old is really distressing. You know, she can't walk, so she's got to be put either in a chair or on a stretcher. But for me mum and for me as her carer, as looking after her, it's just so much easier being on this virtual ward. So when these girls come in, it's kind of, you're told exactly what's wrong, what the treatment's going to be. Someone's there at the end of the phone, and they do things like, they suggest things. So, for instance, her legs were dry, and I was using one type of cream, and one of the girls came and said, listen, try this, and it'll be nice for her legs, it'll be easier for her. So they got me the cream, I put the cream on, and her legs are absolutely fabulous. Now, I wouldn't have known about that, but wouldn't them type of things, and you know that they're there. And for us, it's not the upset of my mum going into hospital when she's poorly. I know exactly what she's going to eat, what she's going to drink, it's there. I help her feed her, she's cared for well. And it's just that reassurance, because I've got the knowledge of what's going on from the virtual ward, that makes that happen. The virtual ward got in touch with the district nurses to say, right, this is the medication that we do, and they always know what's going on. But then also what the virtual ward do, they link with everybody. So about the second time we were on it, again, mum had a water infection. It was something silly like, my mum's got a floating commode and it's old. It was an old little wheelchair. And one of the girls, I was showing them how I move me mum. And one of the girls said to me, that's all rusty there. And I said, oh, well, you know, it's about 4 or 5 year old. She said, I can deal with that, Deb. So the virtual lady got in touch with the people that supply all these things. And within about 24 hours, the old one was took away and a new one was brought, which made our life so much easier. My mum, with her osteoarthritis, the girls from the virtual ward got in touch with like a physio people. They're like part of what we do now. So they came in and looked at, gave me suggestions and give us treatment and stuff like that. They also link with the district nurses. So everyone kind of links together. I had a dietitian come, they link with the district nurses and the virtual ward. Physio people came last week and said that she needed an upgrade on a bed. They then talked to the district nurses, and now she's getting an upgrade on a bed. So everything's linked in. And in reality, the start of it was the virtual ward. It was the virtual ward that made me aware of everything that we could do and said, don't worry, we can sort this, we can get this, we can do this. Even for things like, she needed some antibiotics, this is last year, and her swallowing's gone a bit. So we tried to get it, I tried to get it in liquid form and couldn't get it. So I rang up and said, I'm having real difficulty. I was called back half an hour later and said, Deb, it's at Billingham, we found it for you, just go and get it. So it's the link up of everything that the virtual ward do that make my mum's life so much easier, but my life so much easier, because I know I feel safe. It's the safeness that I feel. So for us, it's absolutely brilliant, and I'd recommend it to anybody, because not necessarily for the carer, but for the patient. So to have my mum in her own environment, she's clean, she's tidy, she's warm, she's well fed. I know what, when she's drinking, a family can come and see her. You know, the kids can come even. You don't really want to take the kids in hospital, but the kids can come and see her. And all them little things make my mum feel better, which would make anybody who's at home feel better. So just little things. Sometimes it's not about medicine. It's about the other things that make someone happy and make them feel loved and well cared for. And you can't get that in a hospital, but you can get it on the virtual ward. So you also helped me with her medical emergency care plan. So a doctor came out from her doctors when she very first moved here, because she was in a doctor's at Eaglescliffe. He came out, we discussed her medical needs and what her wishes were, which were not to go into hospital, and all these things were discussed. Then no one ever looked at it again as her health deteriorated. However, when the virtual ward came on board, they then looked at everything again and said, right, what do you want this? My mum, we had a discussion about it. They updated this plan, and she explained to my mum what one was and does she want one, and then we got one. Now I didn't know about that. I knew about the emergency plan, but I didn't know how to get updated. And the girls from the virtual ward got all that sorted for us. So every time she now goes onto this virtual ward, they're then updated. So she was on it 2 weeks ago. They said, Deb, have you got all the paperwork? I gave them all the paperwork. They re-signed a do not resuscitate because it's only valid for a year or something like that. And then they looked at a care plan again and said, is this what you want? And I said, yeah. And then it's been amended to specifically say that she doesn't want to go into hospital. Our first protocol is the virtual ward. Now, I didn't know any of them things. It was from the virtual ward that I then knew what they were.
Hi, I'm Jess. I'm one of the nurse practitioners. I work for the virtual frailty ward. So my part in virtual frailty ward is helping patients to stay at home and avoid hospital. So it still blows my mind how we can deliver care, hospital-based care, to people in their own homes. It just helps people to stay comfortable and supported by their family. For those people who suffer from dementia, we're not removing them from their home environment. And it's really distressing for people if they need to go into hospital, be away from their family. So we have lots of support from different services, whether it be pharmacists, so we look at people's medication. Some people haven't had a GP review for years. They can be on lots of medications which can be causing complications. We can look at that. We can deliver intravenous medication at home, antibiotics, to try and keep them out of hospital, which I think is fantastic. Patients get regular care, they get regular observations, they can get help and support with their meal preparation, whether it's them washing and dressing, just need a little bit of help. So we can input lots of things, even if it's equipment that they need. We can go in and highlight that someone might need a little chair raiser to help them stand up from the chair, little things. Lots of things are missed when people are in hospital. But us being able to go into somebody's home and notice these things and we can help is just great. I just feel overwhelmed sometimes. I can be part of it, and I am so thankful to be. I feel very, very proud to work for the Trust, and it really gives me job satisfaction when we have tackled the problem and we discharge the patient and they're happy and they're well. And then they've always got us to call on again in the future if they need to. So we're here for support for the families as well. You know, we're really good at listening. We want to keep the patients safe and in their own homes and just comfortable. You know, you can refer to us through your GP, through different services. The hospital can refer to us. Once you are known to us, then that's easier as well. We're hoping to expand and get better in the community, and I'm really excited for what it's going to bring. And I'm really proud of what I do, and let's see what the future brings.